one dreaded disease receding and another potentially on the rebound. This week, the Centers for Disease Control relaxed its coronavirus quarantine guidelines, acknowledging that the disease is here to stay. But at the same time, the virus that causes polio, which had not been seen in the United States in nearly a decade, is now being detected in the nation's largest city. Elaine Quijano is here with more on that. Good morning, Elaine.
Good morning, Michelle. Health officials here in New York City are urging parents and pediatricians to get children vaccinated against the potentially deadly disease. This after the presence of polio virus has been detected in the city's wastewater. Public health officials are warning the presence of polio virus in New York City's wastewater means the disease is likely circulating locally. They're urging those unvaccinated to get immunized immediately. In New York City, 86% of kids 5 and under have received 3 doses of the vaccine. But in some areas, that number drops below 60%. This comes just 3 weeks after a man was paralyzed with polio in Rockland County, New York, the U.S.'s first case in 9 years. Officials fear hundreds could be infected. The likely culprit? Vaccine hesitance. The polio vaccination rate in Rockland County is just 60%, compared to the nearly 79% statewide. Polio used to disable thousands, mostly children, each year, but was largely eradicated in America through mass vaccination programs starting in the 1950s. Doctors say people need to be proactive about making sure it doesn't spread.
If we can go back to having very, very high standards with regard to making sure that people are vaccinated and making sure that the immunization rates are better, that's our best method of protection.
Now, most people who get polio do not have visible symptoms. About 1 in 4, though, develop flu-like symptoms, including fevers, fatigue, and headaches. And according to the CDC, about 1 in 200 polio infections leads to paralysis. So doctors say, the best protection, get vaccinated. If you're not sure, check with your healthcare provider. But really, this is something that they eradicated once, and they say they can do it again. People just need to get that shot.
Frightening to hear that it is back. Elaine, thank you.